Good morning, everyone. Today, in honor of September being Suicide Prevention and Awareness Month, we are talking about the importance of mental health and wellness in older adults. And we get to speak today to a behavioral health professional, Chasity Lange, who works for an outpatient program at the Henry County Health Center called Senior Life Solutions. Good morning, Chasity.
Good morning, Katie.
Hey, I'm so glad to have you on. Just to start us off, why don't you tell us a little bit about yourself?
Sure. So my name is Chasity Lange. I am the program director here at Senior Life Solutions. I am responsible for directing and coordinating the activities of program staff to ensure quality patient care and providing community education to create awareness of our program. I started out working in the field of mental health at the local mental health institute and started in 2003, remained there until its closure in 2015. I did go to Southeastern Community College and completed my associate degree in nursing, and then I also finished my bachelor's and master's degree at Western Governors University for my master's in nursing. I worked as a nurse at Great River Medical Center in the behavioral health department, and then I also worked as a nurse here at Henry County Health Center in the medical surgical department and got some experience there as well. I continued my working career as a house supervisor, and then I took this position last year when we opened. I have been privileged to work in the field of mental health and wellness for over 15 years and to serve as a nurse here at Henry County Health Center for over 4 years. So I'm extremely excited to be part of this much-needed program and service in the community.
Wow, sounds like we have a great person in charge here of Senior Life Solutions. So could you maybe tell us a little bit about Senior Life Solutions?
Sure. Senior Life Solutions is an intensive outpatient group therapy program that's designed to meet the unique needs of senior adults living with symptoms of age-related depression or anxiety, dealing with difficult life transitions, a recent health diagnosis change, or the loss of a loved one. And we are located right here in Henry County Health Center.
So September is Suicide Prevention and Awareness Month. Can you talk about what that is?
According to the America Foundation for Suicide Prevention, the AFSP, there is an average of 130 suicide deaths each day. It is the 10th leading cause of death in the United States. Each year during the month of September, Henry County Health Center's Senior Life Solutions and other programs across the country work together to help bring awareness to suicide and encourage education to help in the prevention of more lives lost. By raising awareness and educating people about the signs that can indicate someone is having suicidal thoughts or are possibly in danger of attempting suicide, we can help to prevent suicide from happening. Suicide Prevention and Awareness Month is a chance to take the time to stop and assess yourself and those around you to ensure those that need help have access to it and aren't living at a risk.
So what are the warning signs of suicide?
Some warning signs and risk factors that may vary from person to person, but include depression, if anybody's had prior suicide attempts, feelings of hopelessness or lack of interest in future plans. Sometimes they can be medical conditions that significantly limit their functioning or life expectancy, social isolation, daring or risk-taking behavior, sudden personality changes, alcohol or medication misuse. A key one is verbal suicide threats, such as someone saying, "You'd be better off without me," or "Maybe I won't be around to see it," and giving away prized possessions.
What can we do to support someone we know and love who might be struggling with suicidal thoughts?
Well, it can be difficult to know how to approach someone who is struggling. Your discomfort may actually just save their life. There are 5 steps you can take to help someone in emotional pain. One is to ask. Just ask the person, are you thinking about killing yourself? It's not an easy question, but studies show that asking at-risk individuals if they are suicidal does not actually increase suicide rates or increase suicidal thoughts. And sometimes they're honest with you and will say yes. Something else you can do is keep them safe. Reducing a suicidal person's access to highly lethal items or places is an important part of suicide prevention. While this is not always easy, asking if the at-risk person has a plan and removing or disabling the lethal methods can make a difference. You can be there for them. Just listen. Listen carefully and learn what the individual is thinking and feeling. Research suggests acknowledging and talking about suicide may in fact reduce rather than increase suicidal thoughts. The fourth thing you can do is help them connect. You can look up the National Suicide Prevention Lifeline number, which is 1-800-273-TALK, or you can give them the crisis text line number, which is 741-741. You can also help make a connection with a trusted individual like a family member, friend, spiritual advisor, or a number of mental health professionals. And the last thing, an important one you can do, is stay connected. Staying in touch after a crisis or after being discharged from care can make a difference. Studies have shown the number of suicide deaths go down when someone follows up with at-risk people.
Well, that kind of leads into my next question. Why is it important to talk about mental health and wellness, and specifically when we're looking at older adults?
According to the AFSP, in 2019, the suicide rates were higher among adults ages 45 to 54 years, 55 to 64 years, and the highest rate being among adults ages 85 years or older. Symptoms of depression and anxiety often go unnoticed or overlooked, and even the person experiencing these may feel or may think this is a normal part of aging. This population is growing more rapidly than ever, and older adults need to know that they don't have to feel this way. It doesn't have to become their normal. In fact, according to a recent study done by Mental Health America, about 58% of people aged 65 and older believe it is normal for people to get depressed as they grow older. We want older adults to know you are not alone and that there are ways to restore your quality of life.
So what kind of challenges then do seniors face as they age, and how do these challenges then affect their mental health?
Yeah, oftentimes depression and anxiety are onset by a major life change. And a person may be feeling sadness, guilt, hopelessness, or worthlessness due to some of these common older adult life transitions, such as retirement, your kids growing older, and starting their own families. Your physical abilities are different than they used to be. A potential new home environment, losing loved ones, and feeling more dependent on others for care. As we grow older, we experience more of these life transitions. Often they can be painful and more difficult. As we compare older adulthood to previous chapters in our lives, many changes that occur in our lifetime are changes we often initiate ourselves. As we get into later adulthood, it is much more likely that some of the changes we experience in our lives are more because of involuntary circumstances we are subjected to, rather than something we signed up for. Change is hard for all human beings, and if we initiate those changes ourselves, it is a little different than if we have change brought upon us that we did not initiate.
Why do you think seniors are more reluctant to talk to loved ones or their primary care doctors about the symptoms of mental health distress, their changes in mood, lack of sleep, trouble eating, all of that?
Yeah, the physical symptoms are typically the most apparent and recognizable. They are usually symptoms that can't otherwise be explained, such as headaches, stomach aches, some constipation, changes in appetite, changes in sleeping patterns, inability to concentrate or think clearly, and just feeling tired all the time. However, often seniors don't necessarily associate changes in one's physical health and functioning as possible indicators of an undiagnosed and very treatable mental health issue. It's not just seniors that have difficulty talking about this. It's everyone at any age. It's difficult and painful to bring up these thoughts and feelings. Oftentimes, people assume that having difficulty with one's mental health is a sign of weakness or somehow different than having any other medical illness. Additionally, there can be a stigma placed on seeking behavioral health care. Often people do not know how to access care and what treatment options are available. Here at Senior Life Solutions, we try to educate communities and break down that stigma.
How can Senior Life Solutions help build community awareness about suicide in our community?
Yeah, we are committed to providing excellent care and being invested in our community. We are always available to answer questions and to provide educational services and information to community members. We also educate other healthcare professionals about the signs and symptoms of suicide and the specific challenges of aging. Throughout the pandemic, many people who had never experienced mental health challenges find themselves struggling for the first time. During the month of September, we are focusing on educating the community on the different ways They can help prevent suicide by knowing the warning signs of suicide, how to help someone in crisis, when to seek help, how to reduce the stigmas around mental health by having open conversations, and much more.
Can you elaborate on Senior Life Solutions and what services you offer?
Sure. Services offered by Senior Life Solutions include a confidential, comprehensive assessment, group and individual therapy, family therapy, medication, education, and management, and aftercare planning, where we continue to engage and support our participants. Even though this is a group setting, each person is addressed individually based on their unique needs.
Wow, that sounds like you offer a lot. I heard one thing in there, group therapy. What is group therapy?
So group therapy is typically 7 to 10 people in a group, and they receive group therapy to help work towards a better quality of life, mental health, and well-being. Group members help each other by sharing personal experiences as well as their strengths, which can boost self-esteem and confidence. By interacting with other members and receiving feedback from the group and the therapist, each member of the group gains a great understanding of him or herself and has the opportunity to create relationships with other people who may be facing similar challenges. During group therapy, the group may engage in open conversation guided by the therapist, which allows the group to support each other and share common experiences. Often in group therapy, participants learn new skills to support their mental health wellness for the remainder of their lives.
How does someone know if they are eligible for Senior Life Solutions or similar programs? Is there a referral process?
So here at Senior Life Solutions, a clinician can provide a confidential assessment to determine if you or a loved one are eligible for the program. Anybody can make a referral to Senior Life Solutions, including oneself, a primary care physician, a specialist, family members, friends, community groups, and nursing or residential facilities.
Do you want to talk about maybe how people do that? Is there a number that they call?
Sure. You can give us a call at 319-385-6552.
All right, Chasity. Well, it's been wonderful having you on to talk about Senior Life Solutions and Suicide Prevention and Awareness Month here in September. Is there anything else that you wanted to tell folks about today?
Yeah, thank you for listening in, everybody. Just wanted to know Senior Life Solutions wants everyone to know suicide is preventable, and it is important we each do our part to bring awareness and help prevent the tragic end to valuable lives. We can help by knowing the warning signs of suicide and how to help someone who is in crisis. Speaking up about the importance of mental health to break the stigmas surrounding it. Know the resources available. Remember, we never know what those around us are going through. So be kind when you can. It just may save a life. By educating yourself on the warning signs, you can help someone in need or save their life. For those struggling, we want you to know you are not alone, and Senior Life Solutions is always here to support you. You can learn more about us by visiting www.hchc.org or just giving us a call at 319-385-6552. We are more than happy to answer any questions.
Couldn't have said it better myself, Chasity. It is something that we need to talk about in our community, and certainly something that we need to support our seniors with and everybody else. So Chasity Lange with Senior Life Solutions here at the Henry County Health Center, thanks so much for coming on this morning.
Thank you for having me.